Hello and welcome to For Your Health. For Your Health is a program that looks at, obviously, health and helps you to stay informed and remain healthy. Joining me, as in programs past, is Caitlin Kirby. She is a health nurse, public health nurse in the city of Quincy. Caitlin, welcome back.
Thank you for having me.
Always, you share a lot of great information. Often, some of these topics, sometimes you and I discuss what would make a good topic. Sometimes there's suggestions through people that you have met.
Yes, a lot of times here in Quincy, our health department, we're located in, we're very lucky to be located in the same building as our senior center. So a lot of individuals that are watching will come in and ask me different topics they want to see. So definitely in this episode, we always give my phone number as well. So if viewers are looking for a certain topic, I'm glad to do some research into it.
Very good. I think it personalizes it for folks. And a lot of times if somebody is experiencing a condition, they're not alone. There's other people out there that are experiencing the same condition.
Yes, and mostly when I do my research, I'm going off whether it's the Massachusetts Department of Public Health website, the Center for Disease Control and Prevention, or CDC, and then a lot of the specifics, so like the American Heart Association, the Arthritis Association. I'll always go off those .org websites. So it's very universal for viewers.
You are a local celebrity here. You had mentioned that often you get asked questions by the seniors that are in the same building as the health department. But your programs do play throughout the country. They play in this region, and they do play, I know you play in Wisconsin, and we certainly thank the centers in those areas for clearly recognizing what is an informative show and presenting it to their audience.
Yes, it's amazing to see how far this show has grown and how many people it reaches. So,
today's topic is going to reach a lot of folks, I'm sure, yet again. Today's topic is osteoporosis.
Yeah, so this is a condition, we'll obviously go into it, in regards to your bones, and especially it relates as we're aging. So I thought it was very important to go over just what it is, some different risk factors, and then some preventative measures to help minimize it as you go forward.
Right. We'll start with the outline first for folks. Yeah. So definition, we will talk about it. When does it occur? Are there signs and symptoms related? And I'm sure there are. Risk factors, diagnosis, treatment, and you had mentioned prevention. So we'll hit all those on this program. Let's start with the definition.
Yeah, so osteoporosis. So that word osteoporosis means porous bone. So as we get started with this, it's important to know that bone tissue is a living tissue that is broken down and replaced constantly in the body. So osteoporosis occurs when the breakdown of the old bone is faster and the creation of the new bone cannot keep up, basically. So this would lead to a decrease in bone mass or density.
See, I never knew that. That's fascinating.
Yes, and this condition can cause the bones to be weak and brittle to the point where like a fall or minor stressor, such as even bending over or coughing, can cause a break or a fracture.
Right, you don't even have to fall.
Yeah, so it's even like, obviously, if you fall a good distance and you break a bone, that can be expected even in healthy bones. But for someone experiencing osteoporosis, even if they miss a step and like just step down wrong, they can break or fracture a bone just from that small height. And I do have an image to pull up on the screen. And in this image, you can see a healthy bone versus a bone of an individual with osteoporosis. So that within the healthy bone, the tissue inside the bone looks very similar to a sponge. The outer part of the bone is considered the hard shell that wraps around the spongy tissue. When osteoporosis occurs, the holes in the sponge become larger, which eventually weakens the bone from the inside and increases the brittleness or weakness of that bone.
That makes so much sense, and the image certainly helps explain that. So when does it occur? Aging plays a part.
Yes, so up to approximately age 30, the human body builds up more bone mass than it loses. But as we age, the breakdown is faster than the buildup.
Of course.
Yes, as with many things within the human body. So that would lead to a decrease in bone mass. So it's very important, as like the last thing we get into is prevention. There are certain daily changes, like lifestyle changes, that you can incorporate to hopefully keep your bones nice and strong as long as you can.
Are there signs and symptoms?
With osteoporosis, it can be known as the silent disease.
Okay. Well,
Because-
that's something else I didn't know.
Yes, because for a lot of people, there are no signs and symptoms, and they don't find out that they have osteoporosis until a break or a fracture occurs. So basically, the bones that are affected by osteoporosis are more fragile. So these breaks and fractures can occur spontaneously as a result of minor falls. Again, I had mentioned those normal stressors like bending, lifting, or even coughing. But there are some signs you may see, like for individuals, if their spine is affected, over time, like they could have a fracture in the spine. And that could lead to severe back pain, loss of height, and spine malformations. So they may have like a stooped or hunched posture. So if you are experiencing that, you do want to, of course, we always say check in with your doctor, because that is, so although they're not signs exactly of osteoporosis itself, if you do have something that is affecting your spine, that stooped or hunched posture, forgive me, I'm stumbling over hunched. But if you have that posture, that could be a sign that you have osteoporosis.
But that's really the only visible sign.
Yes.
Everything else is kind of, I suppose it's internalized, and you really don't know until there's a problem.
Yes. And I will get into, there are certain risk factors that we'll see. So it is important, if you have these risk factors, that you are checking in with your doctor, because they can do a bone density test to kind of determine your risk. So it's very important to follow up to make sure that if you are at risk, that you're taking the right measures to help prevent it worsening.
Right. Risk factors, gender is on the list.
Yeah, so gender, so there's an increased risk in women over males. Typically, women have a lower peak bone mass and smaller bones than men. And as I get into these, you'll also see like hormones can affect it as well. But I do want to say men are still at risk. So especially if they're over the age of 70, that is still a risk factor. So they still want to make sure they're checking in with their doctor and maintaining these preventative measures. We've mentioned many times already, but that increased age, because as you age, your risk increases because that bone loss is happening more quickly than the bone growth. We also have body size. So typically, like slender, thin-boned women and men are at risk, a higher risk for developing osteoporosis.
Right, so we're talking about framed.
Yes, because they have less bone to lose compared to larger boned women and men. Also with race, we see in white and Asian women can be at a higher risk. There's also a link to family history. So even if you don't know if like your parents had osteoporosis specifically, if they were prone to fractures, so potentially they didn't get that diagnosis, but if they were very prone to fractures as they aged, that could signify that you may be also prone to developing this.
Now, the next one, diet, is something that we can control.
Yes, so diet, so this obviously begins in childhood, and this goes all throughout the lifespan. A diet that is low in calcium and vitamin D can increase your risk of osteoporosis and fractures. Excessive dieting or poor protein intake may also increase your risk of bone loss. I feel like every single episode we do that involves your diet, it's very important to have a very well-balanced diet and to make sure you are getting your necessary vitamins and minerals to keep your bones strong.
Hormones, changes in hormones?
Yes, so low levels of certain hormones can increase your chances. So for women who are at a higher risk, you think of that like your estrogen levels after menopause. So that definitely increases your risk. And then with males, we see low levels of testosterone can also increase that risk.
Medical conditions?
So there are many medical conditions that you may be able to treat or manage that can increase your risk of osteoporosis. So this can be endocrine or hormonal diseases, GI diseases, rheumatoid arthritis, certain types of cancer, HIV or AIDS, and anorexia. So with anorexia, you think of malnutrition.
Right.
So any of these diseases and then certain medications that are used to treat these conditions can also increase your risk. So for the medication aspect, I do suggest you check in with your doctor just to see if any medications you are on could increase your risk. There are just way too many to list out.
Sure.
Yeah.
Lifestyle.
So for lifestyle, we see low levels of physical activity increases your risk. Chronic heavy drinking of alcohol and smoking.
So if you have a sedentary lifestyle, not so good.
Yeah, so we'll get into that with our prevention, but you want to make sure you are maintaining exercise in your daily life to really help maintain your body strength and your bone strength as well.
You had mentioned, of course, alcohol consumption and smoking, both of those.
Yes, so definitely alcohol consumption, there's a lot of negative effects. It is a toxin that you are ingesting into your body. And then cigarettes, I know my coworker Christine has been on in regards to all the negative effects of cigarettes.
And there are no positive effects.
There are no positive, yes. So definitely if you are a chronic smoker and you are diagnosed with osteoporosis, it is suggested to stop as soon as possible. Due to high risk factors, if any of those risk factors we just listed for viewers at home, you feel like you check off a couple of those risk factors, make sure you're consulting with your primary care physician. So women over the age of 65, and then men over the age of 70. So you should be checking in with your primary care provider. Also, if you're having that like a sloped or hunched back, that could be a sign. And the reason you would want to check in is they can do a bone mineral density test. And this test is an x-ray that uses low amounts of radiation to determine the density or how solid your bone is. And they typically would be looking at your spine, hip, or wrist. So basically that's important to know just to kind of, as you move forward in life, knowing your risk factors and then making serious steps to help reduce your chances of having a break or a fracture.
Right, right, because there might not be so much you can do about getting osteoporosis, but if you know that you have it, then you can, I suppose, act accordingly.
Yes, even like the family history. If you know your mom and dad had it, it's important to, as young as possible, start making these changes and work with your doctor to help prevent it, because a lot of times, especially in America with our older population, a lot of the decline, unfortunately, that we see is after a fall, where there's a broken hip or a broken bone, because it's harder for your body to heal. So especially with osteoporosis, you want to get those preventative measures incorporate them in your daily life as soon as possible.
Treatment.
So treatment, definitely calcium supplements and vitamin D supplements if necessary. We also see hormone replacements, bone via, and this stops the body from reabsorbing bone tissue. So it hopefully slows the breakdown of that bone. And then there is also biologics such as Prolia, and this is an injectable that is used when no other treatments are working, basically. I just always like to put a disclaimer in, as with any medication, side effects and interactions with other medications may occur. So before even starting a supplement, check in with your doctor just to make sure you're not taking anything else that could interact. We see that a lot with like herbal supplements, like there are certain medications that you don't want to be mixing with because it can decrease the efficiency of that medication.
Sure.
So definitely check in with your doctor and see what works best for you.
Do you know how side effects are determined? Is it considered a side effect if more than one person has it, or is it possible after taking a certain medication, or does there have to be a number of people that experience?
So I don't have like an exact answer for that. In my opinion, when these new medications are introduced to the market, they're studied for a very long time, and typically they'll do it for different groups of people. They'll do like trials with groups of individuals. So they will take surveys on hundreds and hundreds of people taking the medicine to see how common the side effects are. So there's definitely a way that they go about it to get the most common side effects. But even if one person gets a certain reaction, they still typically would tell the general public.
It would be listed as a side effect.
Yes. I don't know that exactly, but just in my opinion, they do a lot of research before the medication's approved for the general public.
Right. And of course, you can have multiple side effects from any one medication as well.
Yes, because everybody's body is different, and especially if you're on other medications, that maybe that clinical trial, that group wasn't on a medication like that. So there are many different factors. So always, any medication, any supplement, check with your doctor to make sure it's right for you.
Biology and chemistry. Very intricate, very
yes.
intricate. But the human body is very intricate.
It is.
Yeah. Boy, that's why I never got into the study of medicine. Prevention.
Yeah, so as always, our favorite topic, prevention. So some steps that you can take to prevent the disease and prevent fractures. So our first one, we have staying physically active by participating in weight-bearing exercises. A good exercise you could do is even walking.
Right, so I'm going to stop you there just to say that when we say exercise, it shouldn't be assumed that we think that you should go over the top.
Yeah, so you don't never want to strain yourself. A lot of times I feel like if I'm trying to go back to the gym, I'll put all my energy in, and then I'm so sore that I won't go back for 2 weeks.
You're a health nurse. You shouldn't do that.
So definitely find what works best for you. A lot of people, especially if you do have osteoporosis, if you are like swimming could be good for you. I always like, whenever I talk about physical activity, I always like to give our Kennedy Center here in Quincy, our Council on Aging. They have wonderful programs that come in every single week, such as Tai Chi, there's weight-bearing classes, and I always, for those who are not in Quincy or not Quincy residents, check in with your local Board of Health, no matter where you are, to see local Board of Health or your local senior center, just to see what's available. Even that goes for different gyms in your area as well, because if you are new to starting that, like newer to starting lifting weights, that can be very beneficial for your bone health. You want to make sure you're doing it properly. And there are people that are trained to teach you how to properly lift, because you don't want to injure yourself.
Absolutely. I like how you mentioned, or that you mentioned, swimming, because swimming is, the body is more buoyant.
Yes.
So you may be doing beneficial exercises and not really feeling it strain your body.
Yeah, so even like if individuals are in pain, like say you have severe arthritis, swimming's a great activity to keep up with, because when you are in the water, the pain is less severe, so it's easier to move.
And it must have something to do with the buoyancy, I would imagine.
Yes, yes.
So drinking alcohol in moderation.
Yeah, so alcohol, obviously, if you have overconsumption, it can decrease your bone density. So make sure if you are drinking, you're doing it in moderation. Quitting smoking.
Another reason to quit.
Or don't start if you don't smoke, obviously.
Another reason not to start, right.
Yes. You always want to make sure you're taking your medications as prescribed. So if you are working with the doctor and you are prescribed medications for osteoporosis, make sure you're taking those as prescribed. If you do have side effects, call your doctor and work with them, and they'll find a different treatment that may work better.
Here we are with diet again.
Diet. So you want to make sure that you're eating a nutritious diet that's rich in calcium and vitamin D to help maintain good bone health. So you would find this in milk and dairy products. Green leafy vegetables. We have broccoli, collards, kale. I've been loving edamame recently too.
I don't know what that is.
So I don't quote me on this. It could be Japanese, but it's almost kind of like a soybean. And depending on how you get it prepped, like I typically get it steamed. So like the outside's a little bit of salt on the outside to give it a little taste, but it's very high in protein, so it's very good for you. We also suggest salmon and sardines, and then different nuts such as almonds, sunflower seeds, or dried beans are good for you as well. In a severe case, like you could always reach out to a nutritionist even, check in with your doctor to see if you could get a referral. Because a lot of times making healthier like diet decisions, sometimes you need a professional to tell you where to start. Because it's really hard when you have habits that you've been living your whole life. Because typically your diet, over generations, you eat the same things your parents ate and so forth.
Sure.
So I always find, like, reach out to a professional and see, just for even advice. You don't have to stay with them forever, but if you have a couple sessions and they kind of go over the groundwork of the best way to have a well-balanced diet, it's a good place to start.
Very good. I guess we'll end the program with resources.
Yeah, so all the information for this presentation was obtained from the National Institute of Arthritis and Musculoskeletal and Skin Diseases, and then also from the Mayo Clinic. So I have both of those links available if people are interested in finding out more information. Both of those links have tons of different resources, such as living with osteoporosis, and they have people that are experiencing that write in their own stories and how they're dealing with it. So if you or a loved one is experiencing osteoporosis, you're not alone, and there are plenty of resources out there to get advice and how to live your best, most comfortable life.
Which we all want to do.
Yes. Yes.
Okay, well, thank you so much for stopping by. Great topic, a great program, and we'll see you back in studio with a different topic at a different day.
Yes, thank you for having me.
Appreciate it. And thank you at home for watching. Please remember to support your local cable access TV station in the community in which you reside.